I'd like to thank Dr. Giri and Dr. Pradeep for chairing this session. The next session is about a hidden wealth session. So the talk is about Sarcopaenia, gut biome and viscosupplements. I'd like to call Dr. Ashok Selvaraj. He's going to talk about Sarcopaenia and Osteopaenia. Welcome, Dr. Ashok. And Dr. Santosh and myself as chairing the session. Thank you.
I thank Santosh at the outset. It's truly a hidden world for me. I don't know about others. At least he made me read about something new. Okay, so hopefully I'll do some justice. If I don't, please forgive me. Okay, so I'm going to talk about sarcopenia and osteopenia. So the less known topic is the sarcopenia. We'll speak about that. What is the definition? This is a relatively new topic. It has been recently included in the ICD only in 2016. It is described as progressive generalized skeletal muscle disorder that involves accelerated loss of the muscle mass. Basically, the skeletal muscle mass, and also the most important part is the function. So what happens is muscle mass grows and it progresses till the age of 30, 35. Then there is gradual loss of the muscle mass and the function, but it is in a plateau stage. It reduces, but in a plateau stage, but it starts deteriorating rapidly after the age of 65 to 75 years. That's when the sarcopenia comes in. So what are the reasons for having the sarcopenia? Where the muscle loss is? It could be due to an oxidative stress. It could be due to any injury, loss, mitochondrial dysfunction due to a genetic condition, inactivity or disuse, which is most common when you age. There may be an imbalance between the protein metabolism. There may be inflammation or there may be apoptosis. All these factors put together causes sarcopenia. So there is a balance between the catabolism and the anabolism. What is catabolism? There is a muscle destruction which happens to various genetic pathways where the muscle destruction or muscle mass change happens. And along with that, there is also muscle formation or the form of anabolic pathways. But when there is an imbalance with this, then the muscle loss happens. So what are the characteristics of age-related muscle atrophy? The sarcopenia is that there will be redistribution of the muscle fiber types. The changes from type 2 to type 1, and slowly when the muscle atrophy happens, they are replaced with adipose tissues. And there is also the shift towards proteolysis, more catabolic mechanisms starts happening, and there is impaired mitochondrial functions. These are aggravated by inactivity, malnutrition, and comorbidities. These eventually lead to decreased muscle strength, muscle quantity, overall lead to decreased physical performance. So how you diagnose a patient who walks into you? There's a simple questionnaire called the SART-F, which has 5 simple questions. We ask the patient when it comes in, how much difficulty do you have lifting a weight of 10 pounds? So you grade it. Then you ask them, how much difficulty do you have walking across a room? And how much difficulty do you have transferring from chair to bed? And how much difficulty do you have climbing a flight of 10 stairs? And also, the last important question is, in the past year, how many times you have had a fall? So based on that, you score them. The score more than 4. When the score is, then you say they are candidates for sarcopenia. So this test, SARCOF, has a low sensitivity but highly specific for diagnosis of sarcopenia. Once you see the patient is positive for following this questionnaire, then you check the hand grip strength. If the hand grip strength is low, then you think the sarcopenia is most probable. Then you check the muscle mass by either DEXA scan or an alternative where you measure the muscle mass, and if it's found to be low in that as well, then sarcopenia is confirmed, and you start treating the patient for sarcopenia. So it's very important to differentiate whether this is the muscle mass loss is either due to malnutrition or due to sarcopenia. In malnutrition, there is reduced muscle mass, but the strength of the muscles is normal. But in case of sarcopenia, the mass is also less, and the strength and the function is also reduced. That's the key difference between either it's due to malnutrition or due to sarcopenia. So coming to the treatment, once you made the diagnosis, the most important aspect of the treatment is the physical activity, where we ask them to do resistant exercises, go for a walk, do some resistances. Once you start those exercises, the muscle mass starts building up. And it's also important to complement them with high protein intake. Now the research is going on to focus on specific essential amino acid like leucine, which can be given them medication formation, and also important to give them fish oil derived polyunsaturated fatty acids. It's also like in osteopenia, vitamin D is very important, and you should also add antioxidant nutrients to the diet. So other aspect which has been looked into recently is the role of gut microbiota in these things. My next talker will speak in detail about it. I'll not go into that, but there is a role of gut microbiota in the muscle loss, the muscle destruction which is happening. There's a complex mechanism involved in that. So if you find that is a reason, we can add that gut microbes, restore them, it will also increase muscle mass. I think hopefully my next talk speaker will look into it more. So the recent advances, there is a drug called bimagrumab, which acts as an antibody inhibitor of the activin type 2 receptors, which prevents muscle catabolism, increases the muscle mass. So it has a more anabolic action on the skeletal mass. And the most commonly available now in the market are the selective anabolic receptor modulators, but they are controversial to be used. We need more research into that to find which are safe, legal way of using anabolic receptor modulators. So moving on to the osteopenia, we are more aware of the osteopenia defined as a gradual loss of bone mass, where when you do a bone scan, it's between the standard deviation of -1 to -2.5. More than -2.5, it's osteoporosis. Between 1 to 2.5, it is osteopenia. So we do a dual X-ray abdominal. This is the standard, gold standard method to diagnose osteopenia and osteoporosis, where you see the vertebral bone, the hip, and the distal radius. So why is it important? When we diagnose osteoporosis or osteopenia early, we can reduce or prevent fractures, fragility fractures in the vertebra and hip, so that it can improve the quality of life of the patients. So this can be prevented, especially it's people, ladies who are post-menopausal are more prone for osteopenia, eventually to osteoporosis. So we have to identify the people who are in risk group, and prevent by asking them to do exercise. The best exercise is asking them to go for a walk 3 to 5 miles in a day, have a healthy diet which includes the calcium and vitamin D, and also have lifestyle changes. So like I said, exercise has protective effect on both the bone and the muscles. Walking increases the BMD in spine and hip, and also it's important to do aerobic resistant exercises. So lifestyle changes, they should avoid alcohol and cola drinks, avoid smoking. What happens when cola drinks is it has high phosphoric acid content. When this high phosphoric acid content is there, it sequesters the dietary calcium and prevents it from getting absorbed. And also this calcium is dissolved from the bone to neutralize this acid, so that this causes bone demineralization. And in diet, it's important to have adequate calcium and vitamin D, and also we should not lose sight of the micronutrients like potassium, magnesium, and also protein intake is important. So based on treatment, the patient has an osteopenia or osteoporosis, the treatment consists of either preventive or a pharmacological treatment. Preventive treatment involves where in postmenopausal ladies, we start them on calcium. So any women above 50 years requires about 1,200 milligrams of element calcium per day, which cannot be given in diet alone. So we have to give them calcium supplements. So calcium carbonate has better absorption, even in patients who have achlorohydria, but who have risk of having urinary stones. It's better to use calcium citrate in those patients. And without vitamin D, taking any amount of calcium is no useful. So your patient should have at least 800,000 international units per day. If they're not getting adequate sun exposure, it's always better to give an intra-articular injection of 6 lakh stat once every year, or they can give weekly doses. Vitamin D toxicity has been over-exaggerated. It has been shown that if the patient takes 10,000 international units per day over a period of 5 months, then only they'll develop vitamin D toxicity. So you don't have to worry about vitamin D toxicity in these patients. So pharmacological treatment when the patient has advanced osteopenia or osteoporosis, basically based on anti-resorptive drugs. Most commonly used is the bisphosphonates, We can use selective estrogen receptor modulators in patient with post-menopause, calcitonin, and newly drug is the denosumab. So bisphenol works based on the binding affinity. The zoledronic acid has the highest binding affinity as we go to the risendronate. It inhibits the key enzyme required for osteoclast function survival, thereby preventing the anti-resorption of the bone and causes apoptosis of the osteoclast. So other commonly used is a fragment of the full-length PTH called the teriparatide. It is an anabolic agent which is given as a daily subcutaneous injection. PTH releases calcium, phosphorus, and stimulates osteoclastic activity. The paradoxical effect is excess parathyroid hormone actually causes bone resorption. But what they found is small intermittent low dose of PTH actually causes anabolic effect. That's why we give a low dose of 20 micrograms subcutaneous daily. Another new thing is the full human monoclonal antibody denosumab. Directly inhibits the NF-kappa rank activator. It's vital for autoclast action, function, survival. It's given as a subcutaneous once every 6 months dose. So the take-home message is sarcopenia is a progressive and generalized skeletal muscle disorder. Early accurate diagnosis and effective holistic treatment strategies help prevent adverse events due to sarcopenia. Vitamin D and calcium supplementation along with exercise are important cornerstones in preventing progression of osteopenia, thereby preventing fractures. Thank you.
Thank you, Dr. Ashok. I would like to call next speaker, Dr. Giri. He's going to deliver a talk about gut biome. Thank you.
Good evening, everyone. So again, a non-orthopedic talk, gut microbiome. So at the outset, I would like to thank David Rajan sir, Santosh sir, and Shyam sir for inviting me for this talk here. So this is a quote from Dr. Rose. Too often, healthcare providers passively await final joint death necessitating hip and knee replacements instead of treating them earlier. This might not be suited to us attending this conference because we are looking at a lot of knee preservation procedures. So in order to preserve the knees, preserve the aging knee in particular, we should understand what goes wrong. So the number of factors, as we already know, have been taught to us from the MBBS days, like obesity, age, female sex, and inactivity. But how do they act? Probably all are multifactorial. Recent pathogenetic mechanism that is coming up is the involvement of gut microbiome. Something called gut joint axis is being disturbed. So what are gut microbiome? For orthopedicians, I really kept this simple. Everything is very Latin and Greek for us. So gut microbiome is now recognized as a separate organ in the body with 10x number when compared to the total human cells, and 100x with respect to the genes of the human beings. All are strict anaerobes, mostly anaerobes, and facultative anaerobes are also there. So there are more than 50 bacterial phyla dominated by 2 Bacteroides and Firmicutes, and more than 1,000 bacterial species. So it's very variable among individuals, and even some are proposing that it's very exclusive too. So the main functions, as recognized previously, are metabolism, helping in the absorption and breakdown of complex fats, etc. And there is a competitive exclusion effect wherein other bacteria are avoided from being bound to the receptors in the gut, for enabling the gut immunity and helping development of gut immune cells as well. And there is something called gut-brain axis, where the microbiota help in maintaining the GIT functions like peristalsis. But the recent topic of interest is their anti-inflammatory effects through microbial anti-inflammatory molecules, or MAMs. So this effect is responsible for most of the reduction in systemic inflammation by the gut microbiota. So let us see one by one how the gut microbiota influences aging, etc., eventually leading to OA and other inflammatory changes in the body or degenerative changes in the body. So this study by Carlson et Marcus et al. Shows it's again an animal study showing that with the aging there is change in the pattern of gut microbiome with the increase in facultative anaerobes and decrease in strict anaerobes, leading to some pro-inflammatory bacteria and decrease in the symbiotics, eventually leading to increase in cytokines like IL-6 and IL-8. This leads to a phenomenon called inflammaging or chronic inflammation with aging. So this has been proposed to increase the systemic inflammation as such, leading to degenerative disorders like OA. And in particularly in females, this study by Lee et al. Shows that when this again an animal study where when the estrogen is knocked out, the gut permeability increases drastically and there is bone loss and again increase in inflammation. So they also found that when they supplemented these estrogen knocked out rats with lactobacillus, it causes increase in bone mass and better pain management in case of OA. There is increase in cytokines like TNF-alpha, RANKL and IL-17 in estrogen knocked out mice. With respect to obesity, with the increase in weight again in an animal study, they have shown that this bifidobacteria is coming down in number and leading to pro-inflammatory cytokines again, which in turn stimulates OA not only in weight-bearing joints but also in other joints. So the popular theory that only mechanical strain causes OA is coming down, and people are recognizing that there is a component of systemic inflammation. So they also found in this study that oligofructose supplementation, which is rich in bifidobacterium, brought down the OA pain in obesity. Again, in obesity, they have found that LPS, tumor-like receptor 4 are all increased, leading to suppression in cartilage synthesis. And with respect to diet, when there is high fat or fructose diet, they found that there is endotoxemia after food. This leads to OA because of the disturbance of gut microbiota again, and high fiber, when this is replaced with high fiber diet or exercise, there is a development of microbiota, which in turn leads to some anti-inflammatory molecule secretion in the gut. Similarly, for exercises, they have found that moderate exercises in turn stimulate anti-inflammatory bacteria like bacteroids, leading to the decrease in the LPS and decrease in the pain in OA. When the exercise is not there, there is increased oxidative stress, leading to exacerbation of OA. They have recommended only moderate exercises. High intensity exercises in turn act in a negative way, provocating OA. So this is again an important slide. I have explained how the systemic causes affect OA. In this slide, we can see that most of the drugs that we give for OA, even drugs for conservative management, starting from acetaminophen, opioids, and some over-the-counter drugs like glucosamine sulfate and chondroitin sulfate, most of these drugs act by altering the gut microbiota composition, thereby causing some change in gut microbiota and improving the pain in OA. So this also explains why some patients have better effect while providing drugs like glucosamine sulfate and chondroitin sulfate, while some patients don't have pain reduction at all. And I have pointed out all the animal studies. There are only very few human studies, and this is one level 1 evidence that has been published in 2017, which is a randomized control trial wherein they gave a probiotic lactobacillus between patients with OA, and the rest of the patients are treated with placebo. At 6 months, they found that the pain scores have significantly improved in the lactobacillus group, and HSCRP has also come down. Anyway, when we have to summarize this, it seems that most of the effects of gut microbiota are due to inflammation, and maintaining a good gut microbiota brings down the systemic inflammation, which in turn is beneficial to OA and other inflammatory disorders as well. But the idea looks crazy as of now, and only animal studies are available. It looks very novel and helps us to better understand the pathogenesis of OA, shifting away from the mechanical perspective. and its therapeutic application as of now is questionable. So the take-home message will be, it helps us to understand the pathogenesis of OA better, and the recommendations will be to maintain a healthy lifestyle, like pointed out by previous speaker. And hormone replacement therapy can be tried in postmenopausal women. We should watch this space for the coming out new clinical trials and therapeutic applications later. Thank you.
Thank you, Dr. Giri. Your talk didn't look crazy at all. We thought something logical is there. Thank you. I call upon Dr. Muniz for the next talk on nutraceuticals, viscosupplements, what can be done for knee pain and OA. We'll have the discussion. I'm sure you'll have a lot of questions after the talk, or all the three talks.
Thank you. Good evening. So, thank the organizers for this opportunity. Hidden World, after reading this topic, one disclaimer, 2015, 2016, almost, regarding this topic, almost all guidelines are out. We are 10 years later. So, actually this must be a forgotten world. And I tried to dig in deep to get any new information from this, because this is almost always spoken about in every forum. So I tried my best, certain points which I felt was interesting, I would like to share in this podium. So I would divide this into as to what to give, when to give, and when not to give. With regarding viscosupplementations, what to give, available products in India, the extraction and synthesis, role of molecular weight and how it acts. So on the left, if you see, there's Synvisc-1 monovis, something related to 1, and on the right hand side, it's Hyalgen and Synvisc. I'll explain it to you further, why it's the differentiation. So essentially, hyaluronic acid is a high viscosity polysaccharide that is produced naturally by the B cells of the synovial membrane. Now, how do we produce it artificially? There are two sources. One is the animal and one is the bacterial. The avian origin is from the crown of the hen, and the non-avian is through bacterial fermentation processes. Now, the bacterial fermentation process, other applications are in cosmetic as well as the other pharmaceutical things. So, Synvisc-1, Synvisc, Hyalgen all have an avian origin, that is an animal origin. Regarding the molecular weight, there are three categories based on the molecular weight: high molecular weight, intermediate, and low molecular weight. It's the corresponding companies are based on that. All the Synvisc-1 monovis fall into the high molecular weight category. And is there any role of molecular weight and its efficacy? Well, it has been studied well previously, and they say only in vivo studies, clinically there's no difference among these, but in vivo studies say higher the molecular weight, lesser the permeability. So the in vivo studies prefer low molecular weight hyaluronic acid for better penetration. Regarding the mechanism of action, it is complex, so many short forms, MMP, matrix metalloprotein, AKT, and all that. Biochemists call this as glycosaminoglycans. Physiologists call, mention it as it behaves like a salt. But for orthopedicians, it's very simple. It's just a lubricant. It's just a high viscous lubricant giving an engine, pouring an oil into the engine. This is all what we need to know. Okay. And whether this is a single or a multiple, again, no consensus. This is an article by Kiran Acharya. One of the proponents of viscosupplements in India is Professor Kiran Acharya. He's from Manipal. Almost all his papers about this. So there's no consensus. The single injection, the monovisc, the Synvisc-1, all those are single injections, has a better half-life of 1.5 days, and this can be given above single shot. The other injections are multiple. They come in 2 ml, and half-life is just for half a day. So you need to give them every week. And regarding evidence, when to give, I'll be talking about the evidence, about combination therapy, as well as my practice guidelines for primary care and general orthopedics. Regarding evidence, this is the epitome, as in this is like, in research you have systematic reviews and you have meta-analysis. So this is a systematic review of all the meta-analysis combined. So this was by Nick Verma. So, and this is in 2015. In 2015 itself, there was a systematic review of all the meta-analysis combined. So that shows the amount of studies which are available on viscosupplements. Okay, and there have been several recommendations by almost all the AAOS, the ULOR, the NICE, the Osteoarthritis Research Society, and everybody has a little less affirmative voice on this. They say it's not recommended, no general recommendation, may, might, all these words are used. So somewhere around it's the gray zone. So, and 2015 there was a Cochrane review also. They have the same consensus on that. Regarding combination therapy, this is of interest now post 2015. The use of hyaluronic acid with PRP, the use of hyaluronic acid with steroid, the use of hyaluronic acid with the local anesthetic, all those are coming up now after the specialists have started to use it. That is after arthroscopy or regenerative procedures. The joint preservation surgeons have started to use this more, and more of data related to this are coming, which are more and more promising of adding hyaluronic acid with these combination therapies. So a general guideline regarding viscosupplements for a primary care would be, these are safe, the adverse effects are less than 1, you can't hurt the patient much. The degenerative, it's indicated for degenerative of large joint as well as small. It is chosen as a modality of failure after initial medical therapy. It is to be noted that it only replenishes the joint and does not replace. And the single or multiple is your choice. For the specialist joint preserving surgeons, most of us here, we can consider it after scopy as well as, think of combining it with PRP and steroid. When not to give, because of the avian origin, the incidence of hypersensitivity and bacteremia can happen. Reported adverse effects include, pain, local site irritation, etc. Coming to nutraceuticals. Now, nutraceuticals is not a medicine. It's just a food or an element. Now, food or an element obtained from plant or animal origin. And if you type on Google nutraceuticals in osteoarthritis, the first thing which comes is glucosamine is the most widely used nutraceutical treatment. Now, again, what to give, when to give, and when not to give. So, what to give, I would use Raju Vaishya's article here, and he's stated the top 10 nutraceuticals used for OA in India. And on the left is you can see the top 10 and various mechanisms of action which you can go through. But of these, the most common ones used are glucosamine, chondroitin, and fish oil. And all these are animal origin. So we need to consider this while giving to people with dietary restrictions, those who are strict vegetarians. So we need to tell them in advance, or caution them. Boss, this is non-vegetarian. They must be all their life vegetarian, and you give them glucosamine, and you made them non-vegetarian unknowingly. So this was something new for me. And later on, I went to see Tendocare tablet. Actually, on the top of the box, there is a red non-vegetarian symbol. So that was new to me. So I want to highlight here. How do they act? Well, it's the same pharmacology, mechanism of action. COX pathway, NSAID acts through COX. All the nutraceuticals acts through the LOX pathway. Chondroitin, glucosamine, rosehip, boswellia. As the previous speaker said, it also acts on the gut microbiome as well. So it's the LOX pathway which it acts and reduces the pain. Regarding evidence, this is decent, as in when compared to the hyaluronic acid, AOS as well as Cochrane has limited recommendation for giving nutraceuticals like turmeric, ginger extract, glucosamine, chondroitin, and vitamin D. This is chondroitin for OA. They've studied around 9,110 people. And the wordings are very nice here. They say, may improve slightly, improve knee pain by 20, probably improves quality of life. Chondroitin has little or no adverse effects. So it can be used, it doesn't hurt, but it has a very minimal use. This again, the inconsistencies in available literature is evidenced here. So this might seem very, this is a funnel plot, and whatever is around the center is consistent evidence. So here we are seeing too much of scattering. Here we can see too much of scattering, and these are all meta-analysis or studies from other countries. So if there's too much scattering, there's inconsistency. If there's inconsistency, the evidence is not that much reliable, is what I want to say. Anything else apart from chondroitin and glucosamine? So the answer is right in our backyard. It is curcumin and boswellia. Curcumin is turmeric. Boswellia is an Indian frankincense. That is, it's mostly here in, not much in Tamil Nadu, but it's in northern India, hilly areas, where they use it for Ayurvedic preparations. So, and there are even turmeric and boswellia transdermal patches for these. So, that much advanced things are here. Curcumin, again, it acts on, it has a curcuminoid longus is the most potent mineral there. And there are so many studies, not only from India, from worldwide, it's receiving attention, and the potent anti-inflammatory action has been highlighted. So there is a systematic review on 31,841 patients. This was a study from Netherlands. So they have studied this, and they have said it has potent anti-inflammatory activity. Same thing for Boswellia, it has a anti-inflammatory effect as well. So nutraceuticals take home alternatives to glucosamine and chondroitin should be considered for those who are having dietary restrictions, especially strict vegetarians. Moderate recommendation for early OA. Minimum of 4 weeks is the standard for nutraceuticals if we are giving for OA. Minimum of 4 weeks, because it has to act at the pain level. I would like to highlight this. Now, why market analysis for doctors? We need to see that the figures are very interesting. See, so this is about Viscosupplements. $4.8 billion is predicted to 2027. Now, compare that to compare that to the nutraceuticals. Okay, it's not coming. The nutraceuticals is somewhere around $474 billion by 2027. That is way more than Stryker, Arthrex, and everything combined. Why do we need to know that? Because these figures are going to be looked into by the pharma industry. And if they know there's so much of money there, they're going to pump in newer compounds. They will say salt is good, they will say sugar is good, and everything, and come in. So, and then produce it to us. So we have to be in a position to really understand which is good and which is not bad. We have to do our homework. We need to go back to the evidence, see which works and which not works. Especially in this gray zone, it is case-based learning and independent case-based learning. So we really need to be on our toes and not get driven by the market just because there's a new compound in the market. So treatment of osteoarthritis, multimodal medications do not compensate for the axis deviation. Physicians need to be aware. What are you going to manage? Pain, inflammation, or what? Combination therapy is good for joint preservation surgeons. Alternative agents like curcumin and boswellia can be considered. So thank you for the organizing committee for having me here. One last thing. So today there was 56 fellows in that photograph. I just counted. And the 56 fellows all trained in Ortho-One. One more thing is, this is just 56 who come today. There are more than this who are not come today, and I guess the number is beyond 150, 200 easily. And they spread all over the country. All because of one man who thought, timing is correct. Sir is just walking in. So it's just one man, and I would like to say, if I had to see further, it is only by standing on the shoulders of a giant. So if we were to see any further, it's only because he showed us the way, and big credits to him on behalf of all the fellows. I would like to thank DVR sir and the Ortho-One hospital for having us here. That is fellows to faculty. Everybody became faculty today. Those who passed out last year, 2 years, everybody became faculty today. So thank you. I hope I did justice to the hidden world part of it as well. Thank you, sir.
Thank you, Munish. You did justice, and you well summarized at the end, where in this market-driven world, you did put it in black and white, and there were no gray zones in your talk. Thank you very much.
Any questions from the audience? Please stay back. Yeah, Munish.
We'll have two important questions as we are running late.
You didn't tell about collagen peptides, the hottest ones. Where did you skip it totally?
The collagen peptides, yes, I just wanted to highlight whichever was in the evidence, and then I left it out on purpose. There's already 2 minutes, I couldn't combine everything together. It's all the same. It's almost the action of collagen peptides, glucosamines, everything is to work on inflammation and reduce. So
Nothing to say.
Nothing to say.
So what about pain relief? Symptomatically, do they feel better by these compounds?
So there were two things. Symptomatically, so are we targeting pain or are we targeting regeneration was the whole question. So are we pain relief? Yes. patients who had nutraceuticals, especially with glucosamine, chondroitin, collagen peptide, or the other compounds, had pain relief, but their quality of life improvement also was good. Lacun's index was good, but regarding regeneration, it never showed improvement.
But
But this good is
can be achieved with natural components also.
like
Curcumin and
yes,
no
yes.
need to take pills. That's what you said.
Mostly. And glucosamine, everything is artificially created and from animal source, etc. We've been using glucosamine and everything for so long. Can consider a shift, probably.
Thank you, Manish.
Thank you.
One question to Giri. You talked about biome, more of bacteria. What about virus? Any evidence on viruses?
No,
Post-COVID era?
Yeah, no, sir. It's only all about bacteria when you look at gut microbiome as such.
So
There is
truly a hidden world. There are a lot of things to explore. You did
Yeah.
throw light on something which you're not giving importance probably.
Yeah, exactly, sir. It's like when we keep reading literature, it's like even Munish highlighted that we don't know how most of the things act, but everything points out to inflammation, and gut microbiome is keeping down the inflammation all through the life. That's how the available literature points out. So even aging and osteoporosis, everything is related to systemic inflammation, and gut microbiome maintains low level of inflammation throughout life. But when we look at the evidence as orthopedicians, leaving aside all the theory part, as such, now at present, level 1 evidence is not there in degenerative diseases like osteoarthritis. There are evidences in rheumatoid arthritis and conditions like that.
Thank you.
There is a lot of study is conducted by Pavasi group. Is a gut microbiome, especially in PGA.
Oh,
that's
again, they are coming out with a term called knee microbiome.
Yeah.
They are telling that knee is as such not sterile, and they are coming out with that is totally different,
Exactly.
I guess, sir.
Thank you,
Thank
Giri.
you.
Thank you for changing our thought process that gut microbiome is only for digestion. So more about gut microbiome, we'll be seeing it more from Dr. Tara also. So we'll go on with the next session. Thank you.
Yeah, I would like to invite, the next session is on Forgotten Well. It's an alternative medicine. I'd like to invite Dr. Terence. He's going to deliver a talk on diet for OA and BMI maintenance.